anus would get very sore. Every day I'd have to put Vaseline around the opening.
Is it a herbal thing?
Herbal, yeah.
What, to increase your libido or your erections?
Erection, yeah.
Okay, where did you get it from?
On the internet.
When you self-harm, is that cutting?
I get really, really bummed out sometimes. Just everything's all doom and gloomy.
So you've lost 0.2 kilograms. So do you think it's a great success?
Yeah.
A great success?
Yes.
Honest?
Yes, doctor. I think so.
I've got months to live.
Is that what they've said?
No more treatment that they're giving up on me. And to see how much time I go.
Good morning, Putney Mead, how can I help?
Should I book you in for Wednesday the 5th?
When?
Wednesday the 5th of November?
For today? Don't have anything left for today, unfortunately.
Sorry, Wednesday the 5th.
I don't know how many.
Wednesday.
It's with Dr. Diman. Yeah, it's a lady.
Mr. Libby.
Hello.
Hans, have a seat.
Yes. Oh.
Right, 6 months since I saw you last.
Is it 6
It
months?
is.
Yeah.
What's the problem?
Well, it's various things. I've been since August feeling really tired. You know, I wake up exhausted and I keep getting, sweats and heart palpitations. But I think the most embarrassing thing has been I have had very loose bowel movement, not diarrhea in the last 3 months, but it's comes out like a little worms, and I never feel I'm getting rid of it all. And sometimes, very embarrassingly, I've messed up my pants, from farting and burping.
Your bowels have played up in the past, haven't they?
They've played up in the past, and this is slightly different in that before I used to get the runs and sweaty. Yes, my anus would get very sore. Every day I'd have to, well, I do have to clean it now, but it's not the soreness where I have to put Vaseline around the opening, before I go to bed. So, yes, there has been problems with my bowels.
Okay, Hans, just pull that up. Okay, so if you pop up on there.
Yeah.
So pull it up.
Yes.
And undo your waist.
Yeah.
And through your mouth, a deep breath. Right. Good. And this one. Good. Okay, fine. And relax.
You did examine me, through the rectum, and I think you said my kidneys were okay. You were feeling them.
Yeah, prostate, I think, probably.
Oh, was it the prostate?
Yeah. You gotta have long fingers to feel your kidneys that way.
Sometimes it's a bit overwhelming just to have to see people and act normal.
My muscles were twitching and stuff, but I think partly it's to do with the sort of stress or anxiety and it playing out.
Yeah, trying to plan your life is absolutely rubbish.
I'm still feeling like I'm in one of those teacup rides.
I try to ignore it and say that everything's going to be okay, but I do get scared.
But don't be too hard on yourself. You've come a long way.
Come in. Hello. Come in. Hi, have a seat. Excuse me. So,
Hi.
How are things?
Yeah, they're okay. They've been a bit bad recently, but
Bad in what way?
Just mood and stuff has been really low, and finding it hard to have motivation to do things, and also been binging quite a lot. So yeah.
Is there any reason why that you can think of?
I think it's probably because I wasn't on my pills. I didn't know how long it was for, but I wasn't taking any for that period.
Did you just run out, or did you choose to stop?
I ran out and I couldn't afford it again.
Yeah. Okay. And when you were on the fluoxetine, how were your symptoms then?
Sometimes there'd be like bad days anyway, but I think I certainly wouldn't get into like anywhere near as black a mood. Like I get really, really bummed out sometimes. Just everything's all doom and gloomy.
It's very difficult when you're speaking to people about problems like this not to take some of it home with you. That's a very important aspect of general practice training, to ensure that that doesn't become too much of an issue in our lives. Alan Bennett said that you had to maintain a scrupulous and vigilant humanity. And in my work, that's something that I always try and remember and try and work towards. And in terms of the binging at the moment, what's going on with that? How much are you doing?
Well, I think it's happening on most days of the week. Only about once or twice if it's a particularly bad day. But trying to get on top of that is a bit hard, though.
Yeah, it's very difficult. What about your menstrual cycle?
No word yet.
Really?
Yeah.
No, since when?
Since, I think, when I first came to you, like 2 years ago, yeah.
Understandable. What about laxative use or anything like that?
Yeah, I'm still using those. I know I shouldn't be, but...
Right, and how often do you use those?
Every day.
Do you? Okay.
Do you get constipated? Or?
Yes, both.
Yeah,
Both. I have both. Yes.
She's going to toilet perhaps 6-7 times in the morning and in the afternoon, and then again during the night.
Gosh. I still have a really bad stomach. Everything I kind of eat still.
It's coming straight through.
Yeah.
Is there any blood when you go?
Sometimes, yeah.
And is it loose?
It's more mucousy.
Okay.
Are you passing a lot of gas? Okay.
I can't go out unless I know where there's a loo.
Yeah.
You know, it just winds me up.
So has there been any blood in your diarrhea? Or the looseness, really, that you described?
I did wander once, and I was with a friend. We were on a walk, and suddenly I had to, this was in the country, and luckily I had to take my trousers down, and I don't think it was blood, but it was a vermilion colour, the feces, and it was wet, and that's happened about 3 times, where on country walks, I suppose. In fact, it happened last Saturday, where I had to go and quickly hide in this woodland whilst luckily, now what I do, I have toilet paper with me to...
Very sensible. Okay, your blood pressure is okay.
Oh, that's good.
I think we need to start off with making sure there aren't any abnormalities on a raft of blood tests. And I want you to come back and see me in 2 weeks' time.
2 weeks, yes. Yeah, I'm sorry to have all these symptoms.
Well, there's certainly a fair bit to get to the bottom of.
That's a bit of a pun, isn't it?
Could be.
Yeah.
But I'll see you in 2 weeks' time.
Okay, thank you, Dr.
Very good.
McKenzie.
What's going on in life at the moment? You're still studying, is that right?
Yeah, just doing my dissertation, and then I'm still at work part-time as well.
Okay. And how are those things going?
Yeah, they're okay. Sometimes struggling to go into university a bit. Yeah, that was like 2 weeks where I just didn't go in, which is bad because I've only just started the year, but...
Okay, and what do you do when you like that?
I stay in bed all day, and sometimes I self-harm a bit, but yeah.
Yeah. When you self-harm, is that cutting? And any thoughts of trying to do more than that?
Thoughts, but I don't think I'd act on them.
So in terms of today, Was it to restart your medication? Or?
I think that would be good.
Yeah, it sounds like it'd be a useful thing for you. Fine, I think we got a letter from the Eating Disorders Service that said that you've been referred for an assessment for your suitability for something called dialectical behavioural therapy. So you're seeing there tomorrow?
Yes.
Yeah. Can we have a chat in about 2 weeks' time?
Okay.
We'll have a chat about what it is they're offering and sort of what support you've got, and we can then decide to go from there. Okay.
Good morning, Putney Mead. Rachel speaking.
Say ah.
Just look up for me.
Ah.
Can't really get to see your tonsils.
I mean, I took a phlegm sample. There's a bit of blood in it as well.
Yeah, I don't think I need that sample somehow.
Hi, Onda. Come in. How are you? Sorry to keep you waiting.
You were almost late.
I know. I'm so sorry. Come and have a seat.
I haven't got better now because I've been really ill.
Because you saw Dr. Andrews, didn't she, because of your chest?
My chest has been unbearable.
Because you were on some antibiotics initially, were you, or not?
Well, they prescribed them.
Yeah.
And I didn't take them because I thought I don't want to mix the antibiotics and the pump. Because I was taking the pump as well because my chest was really bad.
And have you had any temperatures?
I was getting hot. I thought, do you know what I mean? So lots been happening.
Sounds like it. Let's pop this in here. Okay, so your temperature's all right.
Yeah.
You take your jacket off and we'll have a good listen.
I've still got a bit of a cough, but not. Because I'm going away on Sunday.
Are you going to Blackpool?
It's Sunday, because it's my birthday on Sunday.
Oh, lovely.
So
you want to get well for that?
Yeah, so I don't want to be ill. That's what it's, do you know what I mean?
Do you want to lift your shirt up so I can have a good listen? Big breath. And just sit forwards. Again. Chest sounds all right, actually. I can't hear any wheezes today.
Can I check my weight while I'm here?
Yeah, no, of course.
Because I think I've got on my... Everything's gone pear-shaped at the moment.
On you go. Well, only 1/2 kilo, so it's not terrible.
Well,
but, yeah, we do want it to go the other way, but...
But to tell you the truth, Dr. Wallace, I'm trying to do it myself before going to Slimming World.
I think you should go to Slimming World. What's putting you off?
I've lost the form.
You've lost the form?
Yeah.
Do you need another one from Laura?
Not being that I haven't done it deliberately.
No, it's fine. I'll speak to Laura and I'll get her to sort out another one for you because I think it is important to have the kind of support of Slimming World.
Also, I've cut down on my drinking.
Good, because that's empty calories.
But I haven't drunk for 2 weeks.
Good.
But I'm going to have a little drink next week. That's because I'm away, so you do, don't you?
No, definitely. It's got to be a combination of diet and exercise.
I mean, my diet is quite good, really.
Good morning. Sorry, I don't know where I'm going in the afternoon.
I've got some pecans, a valuable source of protein and amino acids.
You can.
Oh, God, I've got a bit of old cake in there. Jesus. There we go. Come and have a seat. What are we doing?
Strange comment. One is, I feel like something's growing inside me, but I just wondered your comments. But the other thing is, I notice in the mornings my skin's tingly.
So tell me about this thing growing inside you.
Oh no, it's probably just I'm just overeating. But it just.
Do you think
feels
you've
like
put on
massive,
weight?
Yeah, I've got a massive gut, which I didn't used to have.
And how much weight do you think you've put on?
Oh, I know. I weigh 14 stone.
Okay.
But I haven't been exercising for a year.
Why's that?
Lots of things happened in business, and I didn't have the stomach for it. Pardon me. Yeah.
Your eyes look a bit sore.
Oh no, that's out for a birthday dinner last night.
Oh, sorry.
Yeah.
So how much are you drinking, do you think?
Oh, at least a bottle a day of wine.
So more than you did?
I don't know what I said last time. We all lie, don't we?
I don't know. You know whether you lie or not.
Well, it's about the same, really. Yeah.
So you drink at lunchtime?
Yeah, I like lunches. So lunchtime and always in the evening, anyway.
Yeah.
Yeah.
Should we feel your tummy? I think that we need to do that. So slip your thing off. So maybe we should just do a whole load of blood scan and just check on everything.
That's fine. Just sit down.
Yeah, just lie down.
Lie down. Okay.
Come in. Hi there, hi. Have a seat. Yeah, good, good. How are you?
Yeah, so I actually wanted to see if I could get some amphetamines because I'm from the US and I did have a scanned copy of my prescription.
Right.
And the doctor had posted my prescription online, so would that be sufficient enough?
I wouldn't necessarily be happy to prescribe sort of amphetamines just based on the prescription from the US. Would you just explain a little bit more about what the prescription is for? And
it's my ADD, as well as I've been having difficulty concentrating. I'm going for a master's right now, and I guess I've been doing without them, and it's not good.
Right, okay.
Yeah.
In the UK, it's not often that we get people requesting drugs like amphetamines. But I think in America, it's much more readily available, so people can be prescribed medication like amphetamines for exams because they're labelled sort of smart drugs. But within the UK, those have been restricted in terms of prescription.
do you feel that at the moment you need to use other sort of drugs or alcohol at all to help manage the stress, or?
I did smoke a spliff once, but that did help, but that's not advised.
And how does that affect you mentally?
Makes me focus.
Right.
Yeah, I can get work
done. It helps, does it?
It does.
Are you sure?
Positive.
Right. And, I mean, do you feel depressed or... Right. It sounds like there's a couple of things, and I'm just wondering what the best way you think of us helping you with that.
I don't know, it's hard to say. I mean, if I could really get those amphetamines, I mean, I almost... I almost cried myself to sleep last night.
In the UK, in terms of prescription of that type of medication for ADHD or ADD, then it's usually specialist prescribed, certainly initially. So what we'd want you to do is see a specialist and for them to confirm that that would be helpful for you. In the meantime, I mean, the other things that we can offer would be some help, some psychological support, help with stress management and that sort of thing. I mean, is that something that you've had before that you'd be interested in?
To be honest, like I'm just, I don't know. I guess like if I did get like a pamphlet or something in regards to it, I'd think about it.
Okay. Often problems are very complex and there are a number of different things that we as doctors can help with, but ultimately the patient is responsible for what they then do with that advice. That can be quite challenging as a doctor to change that mindset, to enable patients to take some responsibility for helping themselves.
Okay, what's the problem today?
All right, I took the medicine for losing weight, and it's finished.
Okay, if you take your jacket off, we better see if there's any evidence that...
Yeah, I hope so.
Okay, where you go. On your pop. Okay, 123.8. Right, so the last weight we did on you was 5 months ago, and you were 124. So you've lost 0.2 kilograms. So do you think it's a great success?
Yeah.
A great success?
Yes.
Honest?
Yes, doctor.
Right.
I think so.
Okay, well let me...
a bit lighter,
So with Orlistat, there are some fairly strict guidelines for us to prescribe it.
Okay.
So continue treatment beyond 3 months only if weight loss since the start of treatment exceeds 5%.
I'm trying to lose weight and it's just not really working.
Okay. I'm going to just wait until it goes 0, 0. There we go.
Okay. So how much weight do you think you've put on?
I'd probably say a stone.
Yeah.
So you've put on 2 pounds.
Oh dear.
Okay.
The body mass index doesn't come up very well with me.
Yeah,
because it basically doesn't take into account my build.
You probably haven't pushed yourself as much with regards to the exercise.
To be honest, when I get out of work, the last thing I want to do is go work out.
I leave the house at 7, and by the time you come back...
The motivation is...
Yeah, I know.
I want to go yoga.
Oh, yes.
Which is very good.
Yes, very good.
The trouble is, I don't know, I shouldn't say, but it's so grim.
What we're trying to manage with it is preventing things from happening in the future, like heart attacks and strokes.
We're not all sporty, but actually having a think, what you might enjoy from an exercise point of view is worth it.
And you were referred to the dietitian.
Yeah.
Is that happening? Still?
Yeah.
Changes?
Yeah, I changed my diet. But because of my knee, I can't do much exercise. The physio told me I should stop.
Yeah, but obviously your knee was stopping exercise, but the Orlistat was stopped because you'd not been meeting the weight loss target. You know, their role is to help you with your diet and weight loss and exercise and performance. If they think that they're not succeeding and that we need to do something else, they might recommend to us that we prescribe something like Orlistat. The reality, though, is that having had it, it's not really achieved the targets that the NHS dictate to me as a justification for carrying on that prescription. Okay?
All right, can I have a painkiller?
You can have a painkiller.
So was it a good party last night?
Yeah, it was. Yeah.
Okay, up you get. Put your things on. Let's just check on stuff, and then we can see you back with the results. Tummy feels fine.
Right.
I can't feel anything there that's
just slack.
A bit of slack. I mean, if you can manage to get back to your exercise regime, you're going to feel so much better because you always do, don't you?
Yeah.
Take that, and then you book an appointment for a blood test with the healthcare assistants. Fantastic. And we'll see you afterwards.
Thank you very much.
Okay.
Have a good weekend.
Yes, I hope so. And you, not too good.
I've got this kind of freckle thing here, which I don't think I had when I was little.
Has it changed at all?
No, it just gets a bit more crispier because I just picked a bit off.
You don't pick and squeeze things.
Squeeze it all the time.
I've got a spot on the end of my nose. And I look at it every morning.
Last Monday, my hand started peeling and all the skin came off.
Pretty classic for something called seborrheic dermatitis, which is triggered by yeasts.
Yes, it feels very much like eczema.
Yes, I get it on my face, on my torso, on my legs.
Okay.
How can I help today? My psoriasis has suddenly flared up. Over the weekend on my hands and my feet. Do you mean psoriasis or do you mean eczema? Well, I was told it was psoriasis last year, but I don't know whether it is or not.
It certainly looks like eczema to me.
Oh, right.
And we haven't got you coded as having psoriasis,
Oh.
but I can check.
With a P, psoriasis?
Yeah, it's a silent one, that's why we call it psoriasis. So tell me about when this came on.
Well, it literally came out like late Friday night, Saturday morning.
Okay.
And it's the same on
show me.
on my feet. You can see where all the little blisters are starting to pop.
It's quite interesting how your skin blisters.
And then they all pop. I mean, all of my feet, it all pops open and then...
What do you normally put on it?
Well, I've been using Chinese herbs on it, which I brought with me. Okay. Because I find steroid cream makes it flare up and then all the skin splits.
Okay.
So
Chinese cream often is made of steroids.
Oh, is it?
Yeah.
Because I find this doesn't work. Those are pills and then they gave me this. promise it's written in Chinese.
So I mean, I have no idea how safe this is or anything, but there is a lot of people that say that one of the reasons why Chinese medicine is so effective is it's got a whacking dose of steroids.
Oh, really?
Yeah.
I didn't know that.
But not monitored.
Of course,
and so
sure.
not safe from that point of view.
And it would be in the pills as well?
It could be.
Okay.
So I can't recommend them, obviously just because we don't know what there's in them.
No.
There have been case reports of these medications containing dangerous levels of mercury, arsenic and lead. There was a big case last year, showed that they even contain parts of endangered animals. And although they're sold as being natural, that doesn't necessarily mean that they're safe.
Now, your liver function isn't entirely normal. Are you on any medications at all?
No.
Anything herbal or anything over the counter? Any supplements or anything that you're taking?
Yes, I did take, yeah.
What's that?
That's the it's a natural stuff for, oh God, is that a sexual thing?
Okay, so it's a herbal thing?
Herbal, yeah.
What, to increase your libido or your erections?
Erection, yeah.
Okay, where did you get it from?
On the internet.
Okay, I would stop that, because do you actually know what's in it?
No.
Let's stop it just in case, because some funny herbal stuff can make your liver test go off.
Okay.
Some medication that's being sold as alternative or natural contains the same ingredients as pharmaceutical medicines. So one example is a herbal remedy that you can take for erectile dysfunction, which was found to contain sildenafil or Viagra, which is a medication that has lots of side effects and can be dangerous if it's not prescribed under the right conditions.
I actually tried one of those Chinese places along the road, and I'm not sure if that made it worse.
What kinds of things did they try?
She was thumping it.
Right. Okay.
And then asking me to like chanting, all that kind of stuff, like fake. I don't think it was.
So probably at the moment I'm not sure if chanting is going to sort out your neck.
Good morning, Putney Mead. Naomi speaking. Hello? This is Putney Mead. How can I help? Putney Mead.
So how are we today?
Pardon?
How are you today?
Yes, how can I help? How can I help?
Chronicles. Thank you very much. I am not bad.
Not bad, okay.
Dr. Smith? Dr. Smith?
Oh.
That's sore?
Yeah, fairly sore.
She won't be able to phone you because she's in a clinic. She's in clinic today.
There's a little bit of normal wax in there, but nothing that's causing deafness.
All right, take care. Bye-bye. 100 years old. That's crazy.
Hello there. Come through. Sorry to keep you waiting so long. Come in. Come and have a seat. So how are things with you?
Not so good.
No?
It's a day, and so other day, you know, down the weather.
Yeah.
And I got months to live.
Is that what they've said?
They say, you know, anything they do make it worse. Now it's come out from the lung, it's my organ. So no more treatment, they're giving up on me. Okay. I'm planning to go in Italy Thursday.
Are you going back to Italy to sort things out, or what's going on there?
Well, I've got a nice flat there.
Okay.
And then give something to the friends, cancel all of the banking and all sort of thing, you know. Now, do you think I need something on a plane? Because the plane is pressurized. And with my breathing.
Yes, that's what I wonder. Let's check your oxygen levels.
Okay. The arthritis attacked me in my shoulder, my neck.
Just relax your hand down. There we go.
I'm disintegrate.
But you're still smiling.
Yeah, no, I keep smiling. People say nothing wrong with you.
No.
Oh, my favourite. I'm very fond of raspberry jam.
We know on the X-ray there's a little bit of wear and tear in your spine.
About 3 weeks now, I've had pain all down my leg, and I was worried maybe it was my hip.
Obviously, I overdid it because I think I'm 20 and I'm not.
I'm afraid that's fairly consistent with being 83 years of age.
It's no fun getting old.
Yeah, I know. People say.
Did you ever have TB when you were younger?
No.
Never. And just remind me, you were a smoker for quite a while.
Yeah, and not only that, the job I'd done, but that's the coaling and...
What job did you do?
As a coalman.
Right.
You know,
okay.
You're too young to remember.
No, I am, but I know what they were.
Coal on your back, you know. I mean, I'd done that for 25 years. I carried thousands of tons of coal.
Yeah.
But there again, that's the job you had to do, wasn't it? You know, you either did them or somebody had to do them anyway.
I think what you're going through is related to all that.
Well, I do honestly.
Yeah.
I can't think of anything else really, you know.
No. Do you bring up much phlegm?
Yeah, it's all clear. It is clear though, but it catches in the night, and I've got such a dry mouth.
Really?
It's dry, absolutely dry. I have to drop of water, like a bottle of water. I don't have a glass of water.
Right.
Don't ever have a glass of water in your bedroom. I'll tell you why, because I always went with a glass of water in a bedroom, and I never turned the light on. I just picked it up and had a sip. And one night I just turned it on, and there was a nice big spider having his early morning dips blowing round in it. Oh, God. I'll never again. But anyway, I digest as usual.
I can't do it. It's quite hard. I mean, my granddad's Scottish. My granddad is Scotland. There's a wee chance of that. Someone cast me as Japanese once. What? I know. I went, are you serious? She was like, you got that oriental look about you. I was like, no.
So deep breaths. Good. Let's have a listen at the front now. Good. That's fine. Has anyone ever talked to you about what we would call what's called a chronic lung disease? Has anyone ever talked to you about lung problems that you might have had that have been there for quite a while?
Well, I've always known I've had a bit of
that scarring.
Bit of a chest, you know.
Okay. What I was thinking when I saw you last time and what they saw signs of on the X-ray is something that we call COPD. Basically, as I say, it's long-standing damage to the lungs.
I can imagine that.
Yeah. What we need to do is do another investigation into it, which is a blowing test to give us a firmer idea. But no, if it's what it all points to.
Yeah.
It's not something that we can cure,
no.
But that doesn't mean we can't improve it. So, the test I want you to do is something called spirometry.
Oh, yeah.
Once you've had this done, what we'll do is start you on some regular inhalers, which I think will help a lot.
I feel better already.
Big breath and then breathe out as hard and as fast as you can. That's it. But short and sharp, not quite so long. So really try and... But better. Do it stronger than that. Really try and blow the end off. I think that's best you got, wasn't it? OK, you ever sit down.
OK.
Let's have a little look at your things here.
I'll tuck myself in.
OK. Do you want a hand? Are you OK? Do you take any regular inhalers or not?
No, not regular.
I wonder whether it might help, because, I mean, there's a little bit of a wheeze there, but should we give it a go?
Yeah.
What I want to do as well is talk to the chest clinic, who know you very well, and just get their advice about how safe it is for you to fly, the risk of the cabin pressures and things like that, and whether, if they think it is safe for you to fly, whether you need to have oxygen on the flight. I mean, obviously, having lung cancer, it is going to make flying dangerous, because we know you've got a lesion in one of the big airways, and the risk is that could obstruct and make your breathing substantially worse. The other thing is, when you've got cancers, it does increase the risk of you having blood clots in the legs and the lungs. So I would recommend getting some flight socks for when you go on to the flight. Don't drink any alcohol, and just try and keep your no alcohol, because that dehydrates you and it increases the risk of you having blood clots.
I got to go there. Maybe because they say the hospital,
go as soon as possible.
And I mean, obviously you've been told that there's nothing more they can do at the hospital. Have you had any thoughts about what you want to happen or what you don't want to happen as things
We've
continue?
been talking about the heart stopping. You want the revival, say no, let me go.
Yeah.
What's the point?
Yeah.
And I hope I'm going to have a nice birthday down there. I'll be 77.
Will you be over there still, or will you be back here?
Of course I've got to be back here.
You'll be back here by then?
Yeah.
Okay.
If you're still breathing.
That's it. And this is now fetal heart.
She's got an ear infection and lots of stuff is coming out.
You haven't done anything wrong, but I think that's just got infected. Ugh.
He doesn't want it.
No, he doesn't, does he?
Hold on, sweetie, hold on.
That's a good grip that you've got. Just trying to stimulate his gag reflex. It's not nice.
No.
So mean.
Sorry.
She's so mean. Well done. Over.
I'm Dr. Mackenzie. We spoke a few months ago.
Yeah. Now, when I last came in, I was pregnant, but unfortunately I had a miscarriage. No, that's okay. But I'm pregnant again, which is great. But obviously I'm really, really nervous. Every time I go to the toilet, I wipe and I'm scared I'm going to see blood. I'm just on tenterhooks all the time. And I was just wondering if I could book an early scan, if that's at all possible.
There's certainly not much point in having it done at 7 or before 7 weeks because it can sometimes be inconclusive, surprisingly.
Yeah.
So you don't want any negative information. You want to either know that things are fine or not fine.
Yeah. And do the risks of miscarriage decrease quite significantly after 8 weeks?
Statistically, probably a fifth of all pregnancies are lost as early miscarriages. So about 1 in 5.
Okay.
So having had one miscarriage is, I'm afraid, not uncommon. So cross fingers, not going to happen again this time.
Yeah.
But even if it did, the advice would remain, well, okay, let's wait for a normal period. And then you try again. If this one happens the same as last time, well then, as I say, it's sad and upsetting.
Yeah.
But it's not the end of the road.
Yes. Yeah.
To try again is...
If I had one miscarriage, is it more likely I'll have another one, or is it completely...
Completely independent.
Yeah, okay.
All right. It's all gone. It can't be that bad.
Come in.
Hi,
have a seat. What can I do for you today?
I've just found out that I'm pregnant and I wanted to check in with the practice and go through whatever we need to go through.
Okay, is that good news?
Yeah, good news.
Congratulations.
Thank you very much. No, quite sudden. I hadn't come off the pill for very long, so I can't believe I'm pregnant this fast.
Okay. And was it something you were trying for?
Yeah. I came off the pill deliberately, so yeah.
You taking folic acid?
No.
No.
Okay.
I'd suggest taking folic acid and vitamin D.
Okay. The other thing that I have on my mind is that I was training for a marathon.
Yeah.
And that's due on Sunday. I'm concerned of running a distance like that in such early pregnancy would have I don't know.
Okay. I think because the risk of dehydration and things is quite high anyway. I know you're not far on.
Yeah.
I just wonder to be on the safe side, I'd say no. Is that all right? Sorry about that.
No, it's fine. I kind of was getting there myself, but it's...
Yeah. Okay.
Yeah, that's fine.
Sorry about that, though.
No, that's fine.
Because you'll have worked very hard.
I did. I spent the last 6 months training. Look, this in itself is...
Are you desperate to do it?
I was. What's more important to you, your health, your baby's health, or running a marathon in the grand scheme of things?
In the grand scheme of
you'll
things,
get
you can
over
always
the
enter
marathon.
next time.
Yeah, exactly.
Yeah.
So how are you anyway?
I'm okay.
Okay. So the last time I saw you, we checked your blood pressure and it was a little bit high, and then you very kindly went on to do some blood tests, didn't you? Okay. You look nervous.
I'm so sorry.
Why?
I tried to overcome it without anyone knowing that I am very nervous. I'm
What are you nervous about?
I don't know really.
We're just feeling a bit anxious.
Yes, I am. And I know it's partly me, and I'm trying to sort of... Thank you for listening to me.
It's all right. That's what we're here for.
Thank you very much.
And we talked last time about your late husband as well, didn't we?
Yes. It's a lot of sorrow within me at the minute, you know. Although it's 4 years ago, and we had a wonderful time and everything. You know, I think he was told he had 6 months to live, you see, and it was devastating because we didn't realise that he'd got anything, you know, so dramatically wrong. He had pancreatic cancer.
Right. Okay.
And we were both kind of numb. The sadness of losing a second husband. The first husband, he went to work and died. I didn't get to him. I walked into the room and I said, I'm so glad I've arrived in time. No. Massive heart attack in King College Hospital. And that was shutting everything off, dealing with the children, you know, the heartbreak and not being able to cry at all, really. No tears. I'm talking now because I probably need to feel that I can have a little bit of help here from you know, and overcome it.
It's obvious it still plays on your mind, and it can be therapeutic talking to somebody.
Yes.
I mean, what do you think about having some counselling? Because we've got great counsellors here, and they could talk to you about your loss. I think it would be really helpful.
Yes. You know, the sadness and the overwhelming sadness. I'm going to cry in a minute.
Oh.
Sorry. No.
You can.
Sorry.
I think as a GP, we do have a very privileged position in that we learn a lot about patients that probably even their closest family members and friends don't really know, because it's often easier to tell somebody totally removed from the situation about what's going on. And to see what some people have to deal with in their lives is quite incredible at times. And if I can actually be a part of helping them through those difficult situations and see them on the other side, then it's incredibly rewarding. This is for you to fill in before you go and give it to the girl on the desk. It's about the counselling, OK?
Yes. Thank you so much. I really appreciate it.
No problem.
How do I appreciate everything? You're very kind.
All right.
I don't know how to thank you.
Oh, anytime. See you later.
Bye.
Cool, thank you very much. Have a nice evening.
And you.
All right. Thanks a lot. You're welcome.
Bye-bye.
Oh, thank God. Oh, finished. Hello, Brittany. How can I help?
I squeal in the night because it's like someone's sticking a probe in my leg. It's absolutely bizarre, and I've had it for months.
So you must be very pleased you're pregnant and also
No, I'm
quite worried.
absolutely terrified.
Are you terrified?
Absolutely terrified.
Sort of getting the sort of bit down and sort of suicidal thoughts and things.
How are you managing with the suicidal thoughts? What thoughts are going through your head?
You know, just thoughts about ending it all and how I'd do it.
I know it's a nuisance when you're there, but it's just delayed things for you anyway, hasn't it?
Thing is, I'm absolutely furious. Away. That was even bigger.
Seriously?
Have a look.
Oh my goodness! Oh my God!
Lisa speaking. How can I help?
Hi, Jackie. Hi, come on in. How are you?
I'm good, thanks. And you?
Good, fine. I've got Dr. Dillon with me, who's just started with us. So she's just watching at the moment. Right. How are things?
Fine, but it's really daft. But I got a bee sting. On Saturday, and it didn't hurt really at the time. But yesterday and today, it's swollen up and it's so sore. So I just went to the pharmacy just to see what can I put on. I've been putting Antisan on it.
Okay.
And I've taken Piriton, but it's just so sore and itchy. But he said, oh, I think it might be infected because it's a bit hot and throbbing. So he said, oh, just see.
So this happened on Saturday?
Saturday.
Yeah. Okay. And I'm just going to squeeze your nails, so it's going to be a bit sore for you. I'm not actually convinced that it's infected.
Oh, good.
It's really difficult with fingers because if you'd kind of got bitten here, it would just swell and it'd be able to swell a lot. Whereas with fingers, for some reason, they can only just swell a tiny bit.
Right.
And if they get to a point and they just get too tight and it gets really sore and throbbing, which is what you're
this is what it's like, but I'm sure that's fine then, do you think?
It is fine. So antihistamines are the right thing to do.
Okay.
The other thing that would be really good is if you can elevate it. So tie your arm up so it's around your shoulder. That would just help gravity to kind of get rid of some of the swelling, and hopefully it would get better. But I don't think it's infected. They're a pain, aren't they?
I know. I mean, I have been stung before, but I can't really remember it. But honestly, even at night, I've been waking up because I've been going on it, and it's so hot and sore. Right. That it?
That's all.
Don't need to do anything. Lovely.
No, fine.
Okay.
Keep doing what you're doing. Yeah.
Lovely. Thanks a lot.
Bye.
Bye.
Oh, and then guess what? When I went home yesterday, I'm like, what's that moving? Them proper ones with a big long leg spider, thin one, Literally, it was right where I had walked into. So I was like, oh my God, I just touched that. Nastiness.
Nastiness.
Hello, come through. Please have a seat. I'm so sorry to have kept you waiting so long. I apologise for that. How are you?
I'm all right.
Great.
I don't know if you remember, I had a spine fusion
Fracture.
operation, yes, to sort of fuse the fracture. I don't know whether this is related at all, but since that operation, I've had these weird, they're very difficult to describe, these weird pains all down through my legs.
Frances had originally come to the surgery a number of months after she'd fallen over in the snow. She had significant back pain, and an X-ray actually showed a broken bone in her back. She went on to have an operation to stop the pieces of bone from moving around, as it was thought that that was what was causing her back pain.
The minute I lay down to go to sleep, turn on my side, and then it's like electric shocks just whizzing up and down my legs, all around my knees, hips, ankles. It's really distracting, and sometimes I squeal in the night because it's like someone's sticking a probe in my leg. It's absolutely bizarre, and I've had it for months.
Had you ever had it before the operation?
No.
When did this start?
Well, it's hard to describe because it's kind of crept up. I'm just sitting like waiting for you then. You know, I had sitting like that and I get pains down here and it's weird. But going to bed, I sort of lie there and it's like, okay, it's starting. I can feel it starting. And then they whizzing around, bizarre electric shock type pains.
Electric shocks?
Sort of what it feels like. They kind of creep up on you and then they go they whiz.
Do you have pain in your back now?
No, the bone pain went immediately as soon as they fused the bones. The muscles have taken ages to heal.
So these pains, is it mostly in your right leg or your left leg or both?
Mostly my right leg.
I might ask you to pop your trousers off if that's okay. Jump on the couch and then there's some more blue roll that you can just pop on your lap if that's okay.
Yeah.
And if you give me a shout when you're ready and I'll come through. Great, so I'm just going to check all the nerves in your legs, if that's okay. What I'd like you to do now is push up off the bed with that leg, and now that side, and pull down, and the other side. And bend your knees up for me and push me away with that leg. Push me away, pull me towards you. I'm just going to lift your leg up and rest it on my arm. I want you to go completely relaxed and floppy. Good. Feel free to pop your fingers on, come and have a seat. Right.
It's weird, isn't it?
It is. I'm not completely sure what the problem is. What I'd like to do is do some blood tests to check some of your vitamins and sugar control and stuff like that, and then see you with the results, and we'll make a plan about what to do. Does that sound okay?
Yeah. But you don't think it's from what they've done on my back? That's what I was more concerned with, that it was...
No, I don't.
You know,
Because the nerves which supply your legs come out much lower down.
yeah, okay.
Okay.
Right, thanks.
No problem.
Thanks very much.
See you again.
You're making tunes for us?
My neck hurts. What are we up to?
Apart from being very, very angry, now I went to St George's. I got there at 2 o'clock. She looked in both ears, clogged up with wax.
Right.
So she said, you have to see the doctor in order to get syringed.
Right.
3:25, I was rather miffed because I was still sitting there.
So I guess what's happened is you left without your hearing test. And you came the other day to get your ears syringed, and there was a problem there. And so your ears are still filled with wax, and I'm going to need to refer you again to get them sorted out. Is that right? Is that where we're going with the story?
More or less,
Yeah,
yes.
okay,
But
fine.
the thing is, I'm absolutely furious.
I've been a bit worried about my hearing in the last couple of years or so.
Yeah.
I don't catch things that people say and everybody else does.
Partner keeps telling me to get my ears checked because she thinks I'm going deaf. She also talks to me when she's not in the same room and expects me to hear her.
The one on the left, it sounds like roadworks at night.
Oh, really?
As I'm talking now, I feel as if I'm hearing out of this ear, this ear, but not this ear. Very well.
There's a little bit of gunk coming out of his right ear.
Let's have a look at the ears now. So what were you coming to tell me today, just about this story? Was there anything new?
Well, actually, I was coming here, hopefully with clean ears, in order to make another referral, because I came to the conclusion that referral you done the last time.
So I've done several referrals for this.
I really understand with Ian why he was so frustrated at being kept waiting at his hospital appointment. The problem is that all the clinics and services are really overused and oversubscribed, and so inevitably there are delays in treatment. Sometimes I think people forget that. People will get the care that they need, but often it may not be as smooth as they'd hope.
But at the same time, I'm not impressed by these olive oil drips, because every time I put the cotton wool in and take it out just before going to bed, it's just the staining of the olive oil.
So the reason we get you to use the drops is hopefully it will encourage it to come out, but if not, it softens it, so it will make it a lot less painful for you to have that wax removed. So I know it's a bit of a nuisance having it done, but similarly, it needs to be done for us to get the wax out.
Yeah, I understand that. What I was thinking, though, is like going back to an old and tested method which worked, was getting the olive oil, not the drops, heat it, and then pour it in, and then put in the cotton wool, because the heat from the olive oil going in is going to melt it a lot quicker than cold olive oil.
But it will also damage the skin in the ear. So I wouldn't heat up oil and put it in your ear. I think that would be a disaster.
I'm not saying it's going to be boiling. It's
you'd warm it, but
just warm it.
Yeah, I probably wouldn't do that, Ian. If it were my ears, I definitely wouldn't. Had you just sat there a bit longer at the clinic, you probably would have wax-free ears now. I know it's a nuisance when you're there, but it's just delayed things for you anyway.
I've got other things to do rather than sit around waiting.
I do get that, Ian, but at the same time, you're going to not have your hearing so well for the next couple of months while we get this sorted.
Nothing unusual then, is it?
Okay, right, all done.
Is it?
Yeah.
Right. I will sort that out.
Okay.
Bye.
Bye.
There's nothing especially wrong, but there is something that's concerning me, and I don't know whether it's something or whether it's nothing or what. But just to give you a bit of background, my best friend was diagnosed with ovarian cancer 2 months ago.
Okay.
And I don't know whether it's just because it's very close to home and I'm seeing her and speaking to her every day, that it's making me concerned about ovarian cancer, other types of cancer, just all sorts, really. I appreciate that this is probably so stupid, but when I push in my ribs here, I feel like I'm pushing something back. Whether it feels like, I don't know if it feels like a gland or, I don't think it's a lump, and I feel like it's always been there. Like it could have been there 10 years ago, but it never would have worried me, never thought anything of it. But now, because my mind is just like in overdrive, it's kind of was nothing, and now it's something, and I almost just need to come and speak to someone, and just so I can.
Sounds like you did need to come. So let's feel your tummy and see what there is. Sorry, hands are cold. So actually, show me where you felt at the top.
Here.
Yeah.
So if I'm lying down now, I actually can't feel anything. But I just find myself there all day going.
Feeling it.
And now, and then I think, because I think that's, I feel like I can feel something constantly, and I know the minute I'm not thinking about it.
Okay, let's start with this and see. Okay, tell me if you get any pain at all. Okay, so when I did that, not painful anywhere?
No.
Okay, let's get you to stand up. Okay, and then show me where, feel it if you can.
If you put your hand there,
Yeah.
I feel like I can feel something.
Okay, yeah, I can feel that.
And then just
you
a little
think
bit,
it's the
and
same
then-
on this side or something on this side. So the same place?
Yeah.
Okay. That feels like muscle, actually.
That's it.
That actually is one of the big muscle groups in your abdomen that we're feeling.
Okay.
As you felt elsewhere, you've got obviously the main big muscle groups, which are in the middle.
Yeah.
And there you can clearly feel those in
Yeah.
you. But I think that's what we're feeling in this case.
Right.
In terms of organs,
Yeah.
you have the liver here, and I
Yeah.
can feel that.
Yeah.
The spleen's kind of at the back, right at the back here.
Yeah.
Then you've got your kind of kidneys there. You
Yeah.
can't feel those, they're further at the back.
Yeah.
Your womb would be about here.
Okay.
Bladder and womb kind of all level, and your ovaries will be somewhere like here.
Mhm.
So it's miles away from
Yeah.
where we're feeling.
Yeah.
In terms of what you felt, I'm definitely not at all worried.
Right. Okay.
Okay.
That's as I said,
Yes,
my
no,
friend didn't have anything
fully
like that at all, and
understandable.
she's the same age as me, and it's completely come out of the blue, and it just makes you question everything, I think.
Yes.
But yeah,
How did she find out then? What happened?
So she said in the morning she'd lie down, she'd press her.
Oh, and she felt something.
And she felt a lump, and so she was just like, I really should just go and check this out and just put her mind at rest. And then fast forward 2 months, she's had a full hysterectomy, cervix, ovaries, everything out. Luckily, she's already had her kids, but now she's just recovering from that operation. She kept saying, as long as, if anything comes out of this, if you're worried about anything, you just go and get it checked out. And which is why I came, really, just to sort of, I'm sure I'm probably being stupid, but...
No, but as you
Always
said,
need someone to
it's
tell
worth
me.
checking out. It's
Yeah.
worth checking it. And something you don't know what it is, it's worth checking.
Yeah.
So in this case, it's fine.
Great.
But if you do find anything else, do come back.
Wonderful. Okay.
All right?
Thanks very much.
All right, bye-bye.
Bye.
See you.
It's like musical rooms out here, boy.
They've all just shuffled around, so they're in different rooms, but we're aware of where they are and stuff, so it's fine.
Come in. Hello. You all right?
Up there, around here, in the car,
Oh no, the room. I get moved around a lot.
Yes.
It's very unpredictable. So In terms of your blood results, we've been trying to decide whether or not you needed to go and see somebody about this tummy pain.
Yeah.
Over a number of appointments, Leslie and I had discussed his abdominal pain, his diet and his lifestyle.
I buy some, what they call, like chicken nuggets. I eat, like, say, 30 of them in one go.
That's quite a lot. The last set of blood results was completely normal. And I think, actually, you probably don't need to go and see somebody about your tummy pain unless it's bothering you.
Unless the blood tests come back a bit.
No, the blood tests are normal. Because we've talked about your diet quite a bit and the fact that it can be very erratic. I think that you can get some tummy pain if you're not eating a regular and healthy diet.
That's right, yeah. And that's why I go to these nutrition classes. So I've been to a couple and, you know, you learn a lot. Initially, you walk out the building thinking, oh yeah, next time I get money, I'll go and buy some of this, some of that, some of this, some of that. Because when I get the money, it goes on what I normally buy. I think to myself, well, I should really buy a whole bunch of salad.
Yeah.
And, you know, just eat like a rabbit for a week or a couple of days. You know, that's what you call it, rabbit food.
Rabbit food. I didn't know you were going to nutrition classes.
Yeah, we had one in the house. And,
what kind of house is it that you live in?
It's like a hostel. I was offered a place 2 years ago and I didn't take it.
Okay.
Because of their rules.
Yes.
Their rules being you can't have a beer.
No.
And it's not so much that, you can't have a beer outside. So I'll give that the elbow. But this place here, they don't say you can drink, but if you do drink in the house, just drink in your room.
Leslie and I have talked about his alcohol consumption. I'd really like to work with Leslie to try and help him to eat a healthy diet and to try and reduce his alcohol consumption. So let's conclude. Your tummy pain, you've had it for 20 years.
Well, yeah.
It's not too bad. We know your diet's very erratic, and you've told me nothing like a swallowing problem or bleeding or weight loss, which makes me worry.
Yeah, okay.
Okay?
Yeah.
Lovely. Good to see you again.
Yeah.
So come and let me know if this tummy pain is worsening, and then we can do a referral.
Yeah, okay.
All right?
Yeah. I'll see you in there.
Yeah.
Okay.
Bye.
Where's the sandwich list?
Egg and cress.
No, I don't want egg and cress.
I don't know, something like chicken, like, I don't know, New York.
Tuna and spring onion.
Tuna?
And spring onion. You only do tuna and spring onion, isn't it?
Never had that one before, but spring onion is quite nice.
Hi, Mark.
Hey.
I'm okay. How are you?
Yeah, right, not bad, thanks. Yeah.
Yeah?
Okay, yeah.
Okay.
Yeah. Well, I had my first CBT appointment for 8 months, I think, last week. So just sort of tweaked a few things that I was doing.
Okay.
Sort of, so I'm just going to try and go to bed at 11 every night and cut out all alcohol, which I've been doing last week.
Mark has suffered with anxiety and depression since about 2012, 2013. He'd previously presented to his GP initially with just tiredness, but then he developed more depressive symptoms and was diagnosed with depression.
Also, I've been keeping like a sleep diary and activity diary. And, like a food and exercise journal as well. And just noting on it when I feel tired and how I feel, what thoughts are running through my head and that sort of thing.
Yeah.
Feeling a little bit better, but sort of mood sort of up and down still, which seems to be, I don't know, I thought I'd sort of, that had improved before, but it seems to still be sort of getting the sort of bit down and sort of suicidal thoughts and things.
How are you managing with the suicidal thoughts? What thoughts are going through your head?
Yeah, just feeling quite down and a bit dejected, I suppose, and just, just thoughts about ending it all and how I do it. But, I suppose they're quite occasional still. They're not like regular, but they're still quite sort of, it can last for an hour or two or something, and quite down and not really want to do anything.
Yeah, and that happens a couple of times a week? Or?
Yeah, it's not like regular. It's probably every other day, every few days maybe, something like that.
And what do you think about what you would do or what your options are?
Yeah, that sometimes, yeah.
And what have you thought your options are?
Just sort of running away or stabbing myself or something like that.
Okay.
You know what I'm like.
Yeah.
I will panic.
You'll worry if you don't know.
And I'm worried, and I panic, and then I get depressed because I don't know what's going on.
Like if I'm asleep, I quite often wake myself up thinking that I'm kind of choking a little bit.
You're not actually, when you wake up, you're okay.
It's fine, but it's kind of like a panicky kind of thing.
I was going to say, it sounds a bit like a panic attack.
I think you put a bit of weight on since I last saw you, haven't you? Yeah, you used to be a skinny chap.
I did. Well, it's all to do with my inactivity and
Oh dear.
depression.
Oh dear, I'm sorry to hear that.
I've had a lot of stress over the last couple of weeks because it's the end of our financial year and we've all been scrabbling to try and do our numbers.
Yeah.
I think you're unwell at the moment,
Mm-hmm.
and I do genuinely think that you will get better.
Yeah, yeah.
You know, I do have that hope.
Yeah.
You know,
Yeah.
that you are ill, and you know, I think we are getting you on the right track, and I think all credit to you because you put so much effort into getting better.
Yeah, thank you.
As well, you know.
Yeah.
And I think that you will have a fulfilling life again.
Yeah.
Mark is definitely someone who is doing his utmost to help himself, and when patients are really trying to help themselves, it does make our job much more easier, and they tend to respond better as well. Unfortunately, part of the problem with depression is that you sometimes lack that motivation and that drive. Are you still seeing the psychiatrist?
Yes, but I haven't seen him for about a month.
Okay, so there's that to do. I know we've got to sort your medication.
I just need some more. But I don't know if I need a higher dosage on the sertraline.
You know, in terms of safety, in terms of those suicidal thoughts, like if they get more common or you're taking them that bit further, then please let me know, let anyone here know.
Okay.
Go to A&E, because that's part of the illness, okay? And we wouldn't want you to do anything when you're not, well.
Yes, yes.
You know, that has such serious consequences.
Yeah. Okay.
Yeah. Should we put a review on?
Yeah.
Let's do 4 weeks, because you'll have seen the
Yeah.
psychiatrist by then, and
Yes.
it'd be nice to know how the chronic fatigue referral is going through.
Yes, sure.
Okay? All right.
Thanks so much.
See ya.
Bye.
Nothing for today, I'm afraid. Oh, actually, I've got a 4:30. That'll be with Dr. Pierce. Yeah. What's the date of birth?
What was the appointment for today?
It's itching. I'm getting these marks around this area. It's mainly upper body and around neck as well.
Okay, let's have a look at the rash a little bit more.
You want to take off?
Yeah, if we lift this up, see where the main bit of rash is. Okay, it's quite noticeable, isn't it? Do they come up as little pustules or?
No, it's the same, but it's very irritating,
Yeah. Okay, and do you share a bed with anybody at home?
No.
Okay. How long have you had the rash for?
This is, I think, about 4 or 5 days, this front side.
And it's very itchy.
Yeah, but the back one, because I can't see it. So.
The back's where it started off, though.
But I think it's not much now, probably.
Yeah, it's not a very specific one, but has been itchy on there.
Yeah, but it's a long time. But the last few days, it's just mainly here, and then yesterday I had a very bad towards the neck. It was like here.
Just very itchy around there. And what do you do work-wise?
I'm an accountant.
I'm an accountant, so not exposed to anything
No,
doing
no, no.
accountancy.
No.
I wonder, just looking at the rash, whether or not it could be a type of rash called scabies, which is caused by a little mite that lives on the skin. It's the sort of thing that you can pick up, sort of sleeping in a hotel bed or anything like that, where somebody else.
It's the same bed I'm sleeping, and it's not being shared with anyone.
Scabies is the name that's given to a condition where the skin is infested with a small mite that lives just under the skin surface. Some of the myths associated with scabies may be that it's a disease that dirty people have, but in actual fact, it's something that we can pick up at any time. This will be something that they would have come into contact with a number of weeks before, maybe really anything up to 6 to 8 weeks before the itching has started.
And yesterday I requested the antifungal cream for because I feel smell down the bottom between legs and armpit.
Let's have a look at the armpits as well. Let's have because we might just try a tablet from a fungal point of view. Okay. And in there, so just it's very itchy around here. Yeah, it could be. It's not very classical of intertrigo. And a similar thing in the top of the groin.
Yeah, here. It's not itchy,
Yeah.
but it's a smell.
The antifungal cream tends to improve that, does it?
Yeah. Because it's after a long time of having it, because it's worked really good.
Well, let's try a slightly different approach to it, and we'll go down the route of a medication, like a tablet form of the cream. The areas where this is happening, whether or not there is a fungal component to it, it's difficult to know. But we'll see what happens with this rash over the next 2 weeks. Okay.
Thank you very much.
Take care. Take care.
What we can do for you is we can either book the next appointment, which will be next week, or if you don't feel able to wait till then, I can get an on-call doctor to call you today. Are you available to take a call today?
Come in.
Well, it started Monday. I've got an abscess or a boil in my mouth. Can you see where it's swollen?
I can, yeah.
Right, do you want me to open it up?
Well, when did it start?
Sunday night, yeah, I didn't think it was. I think it's there on my gum. Can you see it?
Yeah. Let me just wash my hands.
Well, I just washed mine before I came out, but yours are probably cleaner. But I can't figure out why it's affecting my cheek.
So, what did you notice, first of all?
Monday I woke up and I went, no, something with that. Because I wear a little plate, and it's near where the plate is, but I don't think that's doing it.
When did you notice the swelling of the
this
cheek?
morning. I didn't even, I got up and had a quick wash and that. I'm going to need a bath tonight. But I washed like that, I was in a hurry, I went like that, took those bits off as you do. Once a week, shave tonight.
Yeah.
And I got somebody, I went, what's up with your face? I went, what do you mean? I said, well, there's a big swelling in the right hand side.
Let's have a look then, so. Can you put your tongue on the top of your mouth like that?
I can do that.
No, just at the front of your mouth, so like that. Okay, fine. And then just relax. Okay?
Okay.
And does this, I'm just going to press on you. Does that hurt?
Not in the cheek.
Yeah.
Where is it? You can press the bit that you think it is.
Tell you what, just, can you lift that up? That's
How's
great.
that?
Oh, it's a nasty infection, isn't it?
Oh, well, I don't know how I got it. Brush my teeth and all that.
Can you do me a favour? Can you get both of your hands
And what both
lift
ways?
it?
Right, hold
Yeah.
on, hold on. But how's that?
Yeah. That's great. Okay, fine. When did you last go to the dentist?
So that was 2 months ago. I'd never have any trouble with the
so you
dentist.
went 2 months ago.
Yeah, they put it in. I'm due for another checkup.
Did you smoke?
No, I stopped. I'm stopping. I've seen Mr. Passois at the moment since last September.
How many years did you smoke for?
A lot of years. Since about 16 or 17
16,
years.
so 45-ish years.
But I've been chewing a lot of gum, but that wouldn't do it, would it?
No. What about alcohol?
I've cut back down on that and all.
Have you ever drank in excess?
Maybe years ago. That stopped in the last couple of years, pal.
Okay.
Sorry.
Okay, that's
Yeah.
fine. That's okay.
Aye, maybe I've done something that
It
touched
could,
it and I
I
shouldn't
think the
have
most
done.
likely thing is an infection. I
Could
agree,
have
it's a
been
bit
me taking the
unusual.
gloves off, and sometimes you go like that if you're sweating on site. You know.
So what, I'm going to give you some antibiotics to treat the infection. Probably be a good idea to try and see your dentist as well.
Right.
Okay. I'm going to give you some mouthwash
Right.
as well
Okay.
to use just to keep it all clean. So you're going to take some ibuprofen 3 times a day with food.
Yeah.
So that's for pain and swelling. If you're still in pain, you can take paracetamol on top of that.
Going to be high as a kite.
In a couple of weeks, if there's any problem at all
Make
with
an
your
appointment.
gum, you need to come back. Because in people who've been heavy smokers, especially if you've been drinking drinkers as well, we always need to make sure that everything heals up properly. Because if
Right.
it's not, sometimes it can be a sign of something nasty like mouth cancer. Okay? All right.
Thanks very much for your
All
help,
right.
Doctor.
Pleasure.
Shan? I'm saying it wrong, isn't it?
Shan.
Shan.
Yeah.
Shan. Right, Shan.
All right.
Thank you very much.
Bye.
Aaron speaking, how can I help?
Have you brought a urine sample in today?
No, I didn't. One of the tests is a stool sample. Okay. So you'll need to drop that off for us if you don't mind.
Are you able to provide one quickly now?
It's touch and go, I can try.
I've brought a sample because I hope I'm pregnant.
Okay.
Yeah.
Good.
Don't know if you need that.
I don't actually,
Okay.
but I would know it's good to bring it. We don't tend to repeat them here, but I'll ask some
Okay.
questions. The tests that we do here are exactly the same as the ones you buy over the counter. So, when was your last period? Is the first question.
29th of
What do you
June.
mean? June. Okay. And your periods are normally quite regular, are they?
Well, they are, apart from, I don't know if you've seen, but I've had 2 miscarriages and one was recent, so I actually haven't had a period since the
then.
last one.
So that period you're saying on the 29th of June was...
Yeah, the miscarriage.
Miscarriage, okay. Yeah, I'm sorry to hear. I saw that. I didn't realise you'd had one before as well. When was the previous miscarriage you had?
It was April.
April. Okay. And were both of them early in the pregnancy, or?
The first one was about 8 or 9 weeks.
Okay.
And then
Okay.
the last one was like 6.5, 7 weeks. So.
Okay. So you must be very pleased you're pregnant and also
No, I'm
quite worried.
absolutely terrified.
Are you terrified?
Absolutely terrified.
Miscarriage is quite common in early pregnancy, particularly in the first trimester, which is the first 12 weeks of pregnancy. Clearly, it's always very upsetting whenever a miscarriage does happen, and it's understandable at her reaction at being very worried about this new subsequent pregnancy. However, having one miscarriage does not significantly increase the risk of having a future miscarriage.
Any little twinge, I'm like, ugh.
And what happened last time? Did you have some bleeding or pain, or how did it come to light?
So the first one, yeah, pain and cramps. Well, the first one started with sort of a little bit of brown discharge, and you know, you convince yourself that that's okay because it could just be old blood, etc. And then but I did sort of have period pains, and the second one was earlier, and it was the same sort of thing.
What a hard year you've had. That's
I
know. No, not good. Okay.
I saw it this morning.
I know you did.
Well, what was my foot and how I feel, I don't feel good at all. That's why I left the message this morning, that I thought I had some more steroids, but I haven't. So that's what I need, I think. It's been a job to breathe. Breathe through my mouth, not through my nose. It's been blocked up.
Your nose has?
Well, I keep blowing it, you know. But
Okay. And how long have you been having difficulty breathing for now?
A couple of days.
A couple of days?
Yeah.
Okay. You seem more breathless than normal.
Yeah, I am.
Yeah.
I can't do anything without sitting down.
Okay.
All right if I sit for hours, I can't do that.
Can I just check your temperature? And check this side.
I don't think I've got
No. Have you been managing to look after yourself?
Yes.
Yeah? Can I pop your finger in there?
And my foot is killing me.
Have you got an appointment yet?
I've had it. I phoned them up.
Yeah.
They gave me a boot. Well, that's a joke.
Ah.
I tried wearing it, and what that does, it takes you off the floor that much.
Right.
So your hips ache because you're walking out all out of line. No good. It is very difficult, very soul destroying.
I think the hard thing is I don't think there are any other options really.
Well,
apart
that's what
from
he told me.
painkillers and
Yeah.
time. Your oxygen levels are quite low today. They
And
haven't been this low for a while. One option is to go into hospital.
What can they do?
I can't breathe, I can't cope. I wake up 3 times a night and my partner is waking up. It's just getting worse and worse. I can't just breathe because constantly being blocked.
I sort of feel wheezy, you know, sort of that I always need to sort of cough.
Just feels almost like I'm sort of gasping for breath. It feels like I'm just kind of restricted.
Lips tight on the cardboard bit, and then fire the air out fast.
Okay.
So it's a real.
I like your dress.
Thank you. It's new.
That's nice. Nice and bright. Nice.
If you sit forwards for me. And just breathe in and out for me.
I had the blood test this morning.
Okay. So obviously your breathing's not so good today. It's quite a lot worse than normal.
Yes, I know, for what I can do.
And your oxygen levels are quite a lot lower than normal as well. One option is to go into hospital. The other option, which is potentially more risky, is to try and look after you, you know, here and at home.
Well, if I could have another go here at home.
Okay.
The benefits of staying at home compared to going into hospital is that there's less waiting around. It tends to be a less stressful environment for their recovery. Also, they tend to sleep better as it's less noisy. And also there's a reduced risk of infection. If we felt it was safe for somebody to stay at home, we would always try and keep them at home. But obviously we need to take their wishes into consideration as well.
If you tell me exactly what I've got to do,
Yeah, okay.
then I'll do it.
Yeah, I'll ask the respiratory nurses to come and visit you tomorrow.
Yes.
Okay? But if you have any problems, call the surgery as well.
Okay.
Yeah? Because we can
What
help.
such as problems?
Well, look, if your breathing's getting worse or you
Yeah.
can't manage at home.
Yeah, well, I would tell you. then.
Yeah? Okay.
Thanks a lot.
All right.
Yeah.
Pleasure.
Thanks very much.
I'm seeing you next week, aren't
It
I?
was raining when I came.
Looks
I
like
had
it's
to back
stopped
off.
now.
I think it's all right. Thanks, Doctor.
All right.
Thank
Bye.
you.
Other way.
What may be worth doing, given your history, is getting you an early scan in the pregnancy.
Yeah,
so
that would
we
be
can
good.
check everything's going okay.
Yeah, that was one of the things I wanted to talk about, and then just if there's anything that I can do. Obviously, I'm willing to just try. I've stopped running, which probably I don't know if it's a good thing or a bad thing. I'm really trying to do everything I can, so at least then I can say to myself, with nothing I've done.
Yeah, and I think that's normal to do that, and I think that's probably an appropriate thing to do. There isn't any evidence that running in any way will affect or doing sport will affect it, but human nature being what it is, it's not. If that's a decision made, that's fine to do that. Yeah. To be honest, whether it makes it better or worse, it's mostly out of your control because it's more to do with the DNA of the embryo that's forming rather than anything that you are doing. I think it's really, really hard when you've had such a difficult year. I think the best thing we could probably do is figure out your dates now and try and get you a scan in about 7 weeks so we can see, and there's an early pregnancy unit at St George's.
So what will they be able to see at this early stage?
And hopefully at 7 weeks you should be able to see a heartbeat, you should be able to see the gestational sac in the womb, and if they can't, what they would do is then bring you back the following week so they could scan you again.
Okay.
All right.
Cool.
Okay.
All right.
Do you want me to dispose of this?
Yeah.
I don't really want to carry around.
Lovely.
Okay, well, I hope it all goes well next week.
Yes,
Okay.
I'll let you know.
Good.
Thanks very
All
much.
right. Bye.
I'm not too sure. Bear with me a moment.
Is ear syringing messy?
Messy? They get messy, yeah.
No, they won't get messy.
No, it won't get messy, no. All right then, okay. Bye.
So have you had your ear syringed before? No. Irrigated or anything, no? It's not a painful procedure, it's just feels a bit weird, warm water in your ear.
Okay. Yeah.
Just come and take a seat over here. Thanks. So if it does start to hurt, because it's not supposed to, then let me know and I'll stop. I'll put this here, don't get wet. Hold this cup under your ear like that for me. Look straight ahead. Keep your head just like that. Like that, straight ahead.
Yeah, cool.
You ready?
Yeah. Oh, wow. Those are right, actually. Whoa.
There it is. quite little lumps come out.
Oh my day.
What?
What was this?
That sounds bizarre.
How does it feel?
I can hear you. You sound like you're shouting.
Have a look in the cup if you want. Does it feel good then?
It feels amazing.
There you go. Let me have a look.
Oh my god.
That's the best reaction I've had.
I'm gonna listen to some music tonight.
Yeah, enjoy. All right, let me just move you around here just a little bit. That's it, and then out. All right. Let's look straight.
Yeah.
I'm gonna begin, yeah?
Yeah.
There we go. Wow. Wowee. That was even bigger.
Seriously?
Have a look.
Oh my goodness. Oh my god.
What? The hearing?
Oh my goodness.
It's weird, isn't it? Let me have a look.
That is amazing.
Let me just look.
You don't value
Your hearing.
Until it gets taken away from you, like from the guts or something.
You see the big lumps in there?
I see.
Mm.
It feels weird. I can hear myself inside.
Right, there you go. 2 crystal clear ears. Oh, sorry.
Oh my goodness. I'm meant to feel like this. I can hear
Yeah,
myself inside.
because you're not used to having normal hearing. They've been blocked up God knows how long.
Yeah.
So this is how sound should usually be.
Okay. Oh my goodness.
There you go. Happy?
Yeah, I'm more than happy.
Good. There you go. All right. Take care. If ever you need it done again, you know what to do. Take care.
All right, nice to see you, Barbara. Bye.
Nice to see you. Take care. Bye-bye.
All right.
Love to see you.
That's okay. Thank you.
Okay, lovely. Thanks for seeing me.
No problem.
Yeah, thanks a lot.
Take care.
Diagnosis is a detective effort. You're constantly curious. It's important to leave no stone unturned.
This one is just blown.
And did it bleed at all?
I don't know.
Mhm.
I can't even touch it.
We meet a number of patients who we have to explain results to, and if someone has got anxiety, there are different methods we would try to do to break the news.
What do you understand so far?
All we've heard is autoimmune, we've had possibles like maybe some form of cancer, we've heard all kinds of crazy stuff going on.
We believe about half of all men between the age of 40 to 70 will suffer with some degree of erectile dysfunction.
I see an improvement. I see a massive improvement. I don't think he does.
No. And when you say dizzy, what's happening?
Just going around.
Room spinning around.
Yeah, anything up to quarter of an hour.
So I'm a bit concerned about it, really. So what should be happening? It sounds like quite a severe symptom.
Hello. You've been in the wars, have you? Literally. Right. So what happened?
I went inside this park. I was trying to jump over the fence when we were going out. So my foot got stuck in it.
Yep.
And I fell down on the hard floor. And I
Whacked your eye. Straight on like that, yes?
Straight on. She
Oh,
got
dear. Okay.
this injury over here, and it was quite swollen at that time.
Yeah.
But
When
at the
did it happen?
On Sunday.
On Sunday. Okay.
Yeah. At the moment, it has gone all over her eye.
Yeah.
So
You can be hit over here, and you can still end up with a black eye. It's almost as if with all the tissue in the scalp and around the eyes, when it bleeds underneath the skin, which is what a bruise is, it's very vascular, so you get lots of bleeding, and it can track down through the tissue planes and will end up around here. So it's really common to get this, even though the hit was up here, often it will come down here. Now, what I need to do is just make sure there's no deformities of the bones. You're very brave. Okay, there's none of that. What I want you to do, okay, is look at my finger and just move your eyes to follow the finger. Can you do that for me? And what I want you to do is tell me if you get any double vision, okay? So head nice and still, ready, follow. Okay, only one finger?
Yeah.
Good. She's going to be fine. Okay. So there's no deformity of any of the orbit, okay? What we check for then is just in case sometimes you get a little crack inside the orbit and the muscles that control the eye can get stuck a bit, okay? So if that happens, then the eye doesn't move as well on one side, so you end up getting double vision.
Right.
I'm happy she's not.
Okay, so she doesn't have...
Yeah, so I'd keep an eye on it, just see how that goes. You would expect this to slowly get better over the next 7 to 10 days, okay? So it will change colour, it will turn into a sort of a deeper, then it'll go sort of a brownish colour, then it will fade away as the body absorbs that sort of blood back into it. But it may even look a little bit worse tomorrow. Next time, don't jump over that fence. Okay?
Thank you very much.
Bye-bye.
Bye.
Hiya.
Hello. I wonder if I could get an appointment to see the doctor.
A routine appointment or is it something urgent?
Well, what it is I've just come away from the hospital. I went for an assessment for an operation on Tuesday and I can't do it because my blood pressure is way too high.
Okay.
So they've given me a letter to give to the GP and get on medication straight away.
Okay.
I have cancer and obviously I want to get the surgery done
Quickly, okay. I'll go and speak to a doctor and see if we can fit you in on the emergency list. Okay? Yeah.
Come in.
I'm going to scream.
That's all right. How you doing? All right? Good.
Why don't you and me get married? I'm out there so often, don't I?
Oh dear. Right, blood test. Okay.
I've had so many. I'm sure that not get the right things, right.
No, it's fine. They're all different sorts, aren't they?
Are they?
Yeah, different ones that we're doing for you. There you are. Right.
If you're hurt now, we'll play out.
Oh, be on your best behaviour now. Nice straight arm like that.
Okay, lollipop.
I haven't got, look, I've got badges. I'll give you a sticker.
They always give something away, didn't they, to please the kids?
Children, not grown-ups still.
Shut up, Scratch.
But we never grow up.
Oh, look.
I feel as if my life is now ebbing away down your jar.
Oh, gosh, you listen to it.
Oh, most men are really squeamish, aren't they?
Yeah, it's really bad, really, but then there you go.
Oh, I don't have a baby.
It's not that bad.
Are you sure? Have you had some?
Yeah.
How many?
One. One.
Thank you very much.
What's that, sorry? This is a BNP, which I believe it shows the level, well, to see if your heart's enlarged or not. Yeah, so is this to do with shortness of breath?
I've got a big heart.
Oh, I
Believe
bet.
me, I've got a really big heart. Would that show up if I've had a couple of beers today, a couple of drinks today? It won't. Oh my God, look at that. She's had a go at me on the way down here.
Have you? I bet.
I thought, oh God, I've got to go to the doctors again. I had a beer, I had another beer, went into the greenhouse, I sat there, doing my plants, and I thought, this is lovely.
I'll have another one.
And then she arrived and she went, you haven't been drinking, have you?
Yeah, I bet, yeah. No, it's hot chocolate weather, not beer weather.
So
right.
that's it.
That's it. All done, okay?
Thank you very much.
All right, nice to see you.
And you have a nice day.
And you. Bye-bye.
The anaesthetist found my blood pressure but so high that he said he didn't risk and I needed to come to you straight
Oh, really?
away and
Okay.
get medicated.
Yeah, sure, let's have a look. So,
there's the letter.
what's the operation you were having?
Well, this one is only a bowel investigation. I've had 4 liver biopsies.
Yeah.
I've got 1 more liver biopsy tomorrow. But my bloods are showing very high for cancer again. I've had breast cancer, I've had node cancer, and I've had bowel cancer.
Yeah.
So they want to do, what is it, when they put the camera inside? And they want to do it while I'm out. And they're assuming probably that I've got cancer in the bowel again.
Okay.
So, yeah.
Ah, nice to see you. Just take a seat. Just over there. No, that's my chair. We know people who drink wine have fewer heart attacks than people who are teetotal. Say, oh, say off. Oh, that's good. Yeah, good. I mean, we could do a T4, but I think you have more important for fish to fry. How can I help?
The last 5 weeks, I think it is,
Yeah.
I've had ear infections.
Both sides?
Yeah, this one is just blown. I can't even touch it.
When did
Can't
it do
see.
that? Yeah.
Yesterday.
Okay. And did it bleed at all?
I don't know.
Mhm.
I can't even touch it.
Is there anything coming out of it?
I've been putting
Drops of some kind?
cod liver oil in it.
Olive oil.
Yeah. Cod liver oil. Yeah.
Are you a cigarette smoker?
Yeah.
Okay. Can I examine the ear?
If you can. It's going to kill me.
No, I don't want to kill. I don't want to kill you. On the other hand, I can help you best if I get examining it. Yeah. Have you been on any antibiotics for it at all?
In the last 4 weeks, yeah.
Oh, it's really inflamed. Do you get eczema?
No.
No. Just turn around to the other side. How's this ear?
This is the one I was supposed to have had syringed today, and I said I couldn't do it.
Yeah, I'm sure you find it'd be difficult to bear it. Just have a look. But it's nice, it's much clearer and much less swollen than the other one.
Yeah.
I'm sure it's still so. Do you put cotton buds into your ears?
Only now and again when I clean them.
So before all this started, how many cigarettes you used to smoke?
About 5.
5, okay. Yeah.
I'm not a heavy smoker anyway.
Yeah, just open wide your mouth.
I can't, it hurts.
Okay, as hard as you can. Sorry, now say, oh, good, well done. That's good. Nicotine predisposes to ears, nose and throat infections. Are you on any painkillers for this?
They give me antibiotics and that's it.
Okay, and
The strongest ones you got I can take.
I can imagine, yeah, absolutely, yeah. Okay, so either of these antibiotics might make you feel nauseated or vomiting. If they do, take one of the anti-nausea tablets. I apologise for the nausea or vomiting in advance, but there's no other substitute for this one that can make you a bit sick. I'm sure you do, but these tablets will make it better. And it's only about 1/3 of people who get nausea on this second one. But you need both, okay? Because this could turn out to be quite serious if you don't take both. I'm giving you a strong painkiller. I want you to take 2-4 times a day. Okay. Good.
Lovely, thank you
Good.
very much.
All the best. Hopefully
Thanks.
that'll help. Try and drink as much water as you can. I know you won't feel like it, but fluids are really important.
I feel sick at just drinking. I've been sipping water.
Yeah.
But
Yeah.
it just makes me feel sick.
I know, but you'll be feeling more nauseated if there's nothing in your stomach. If it's
Okay.
empty. So try and manage your best, okay?
Lovely, thank you very much.
Yeah. All the best.
Thanks.
You're welcome. Bye.
So, these readings are very high. aren't
Yes.
they? Do you smoke at the moment? Yeah. How much?
About 20 a day.
Okay.
I'd say roughly about 20.
Okay. Ever thought of quitting?
I've been here once or twice.
Okay. So, I mean, on the basis of this, we definitely need to start a medication.
I hope so, because otherwise I won't be able to have surgery.
Yeah.
Miss Smith had a background of bowel and breast cancer in the past, and she was being planned for an investigation called a colonoscopy to see if there was any evidence of any recurrence of her cancer. She had her blood pressure taken at the hospital that morning, and unfortunately it was very high. And so she was advised to come and see the GP by the anaesthetist to see if potentially she could be started on some medication to help improve it.
There's a tablet that we call a sort of a water tablet. I don't know if you've heard of these types of tablets before.
What is it, water? You mean that you'll urinate more? Because I urinate
Yeah.
way too many times.
So that can be a side effect. The other tablet is something called amlodipine, which is a different type of tablet. It works in a different way. And the main side effect of that one is that it can sometimes cause your ankles to swell, but not always.
Ankles?
Yeah.
Okay.
So perhaps we could try that one? Yeah? We'd obviously have to bring you back to have that checked again.
Yeah.
Just to see how things are going in about a week's time, say.
Okay, so make an appointment for a week.
Yeah, would that sound okay?
Yeah, that's
Yeah?
it.
Given how high your blood pressure was today, there is every chance that you might need to either increase this or even at a later point give you a second medication for blood pressure, potentially,
Okay.
just to kind of let you know that's how things normally go.
Yeah.
But you might be fine on this tablet, and that may be all you need.
Okay, thank
All right.
you so much.
Take care.
Bye-bye.
Bye-bye.
Come through. Hi, come and take a seat.
Thank you, Jacob. I just have an appointment for checkup. I think I just get this one.
How old is Anthony?
How old he is? He is 5 now.
5 months
Yeah,
old.
yeah.
So why didn't you come for the 8-week check?
I don't know, because we was be in Poland, then...
Did you have it there?
No, darling, no, injection.
Has he had any of his injections?
No, darling,
None?
No.
Okay, Agnes, it's very important. The system in this country, it's very, very important that the babies don't miss the immunisations, okay? So we don't like people to start travelling around when otherwise they miss all those things that they need happening. So at 8 weeks, we had to check the hips, the heart and the eyes. Very important for us to do that, okay? The immune cells that mother gives to the baby by the placenta, they start to produce as the baby's getting older. And it's really, really important that we start those vaccinations from the age of 8 weeks. There are incidences where babies do slip through the net, unfortunately, especially in Slough, as we have a multi-diverse population. Travel is very common, and therefore appointments can get missed. Is his weight increasing? His weight, has it gone up?
Oh, he's grown up?
Yeah,
Yeah. He's
okay.
absolutely fine. My mother, he said he's looked like
Sure.
1 year.
Lovely.
Yes, yeah,
Does anyone smoke in the house?
Yes, we're smoking. No, in the house, never outside.
So you and Dad both smoke?
No, only I'm smoking. Okay. He's not smoking.
Okay. Have you been going to the health visitor?
No, I didn't.
To the clinics? No.
No.
Try to go to the health visitor clinics. They're really good. They'll give you advice about feeding, which food you should
Do
start.
I have to go? Oh.
It's better to go. Just
but
at the...
I have a second child.
I know, but we need to check the weights.
I don't think so. I will have a time for that. But
Why is that? Are you working?
No, actually, Jacob is just going to school, and I'm just care about with.
No.
my
If you
husband's
ring
father.
them, they can come to your house.
Oh,
Okay.
okay,
We
fine.
need to start getting weights. We need to get weights done for him as
Okay,
well.
yeah,
Okay.
okay, fine.
Lovely.
Ira Hasnain, please. Hello. Right then, come and have a seat. So, Ira, you're getting a big girl now, aren't you? Yeah? Do you go to a nursery or to preschool?
To school.
You go to school?
You go nursery school, don't you?
Yeah, do you like that? Yeah, is it lots of fun?
Yeah, we've got a fun day later on today. Fun day.
Oh, wow. So, because you're a big girl now and you're going to nursery, I've got to give you 2 little injections. And do you know why you have to have injections?
I'm brave.
Because you're brave, yes. And because if you get your injections now, then hopefully you won't get sick when you go to big school, will you? And you don't want to get sick when you go to big school because you'll miss out on everything.
All the fun.
Yeah. Okay, so just 2 little injections and then I might have I was brave for the nurse stickers. Yeah, so we'll have a look at those in a minute.
The lion one.
Your lions are very brave, aren't they? Right, you sit on Mummy's lap then.
On my lap then, Ira. So we have this done and then later on we go to the fun day at nursery.
Yeah. That's it, good girl. All right, okay, you look at Mummy. That's
Look at
it.
me.
A little pinch. Good girl, little sting. Good girl, well done.
It's
well
okay.
done. Well done.
Oh,
good girl.
that's okay.
Do you want a sticker? Do you want a sticker now?
Do you want Which one did you want? Where's your lion?
Oh, lion. There he is. There,
There
bravery
it is.
sticker.
Oh, wow, you're so clever. Look, so clever and brave. There we go, 1 lion, and then maybe you might get another one.
Yeah.
Yeah.
Just turn
Good
around.
girl. Good girl. Wow, you're so clever. Well done.
Good girl. One more little pinch. Good girl. Little sting.
That's it.
All finished. All done.
All done. All done. All
All
done.
done.
Oh,
Good
sorry,
girl. Well
darling.
done.
Wow. Well done, Ira. Let's go home and then we go to our fun day, yeah? Shall we go to our fun day? Did you want them on the sticker?
We've got a pink elephant.
So nice.
And we've got a koala bear. No. Are you happy with your lion, or do you want one for later, maybe?
I'm going to tell all the teachers.
Yeah? You can go and enjoy yourself now.
Yeah.
Yeah? No more injections.
You were so brave. All the children have to be brave, like you. Yeah, you can tell them you were so brave.
Yeah.
Yeah?
Nobody ever wants to speak to me after I've given them injections. All right then, take care. Bye-bye.
Thanks very much. Bye-bye.
Hello.
Classic.
So we just checked the feet. Lovely. Just want to check his ears. Lovely. I'm just going to check his hips as well. That's lovely. You can get him ready now. Yeah, there's nothing abnormal. His eyes, heart, and hips all seem fine. There's no birthmarks, and there's nothing in the mouth like a tongue tie or anything like that. So that's all good. Pop back outside and see the nurse for his immunisations, okay, vaccinations. Okay. And then from now on, just record it in here and ask the reception for the health visitors numbers.
Oh, okay.
So I'll come with you.
Okay, fine.
Yeah,
okay.
let's pop outside and we'll have a check now.
Please, thank you. Oh, sorry.
Come through. Oh,
Sorry, thank you.
come through.
Okay, take a seat in the waiting room.
Thanks.
Can I help you?
Hello, I'm in here today. Come in, have a seat. How are you?
Still getting the dizzy turns, but not quite as often.
Okay. So you've had quite a few, you had some falls when I saw you last time.
Yeah.
What's happened in the 2 weeks since then?
I've had one where I come really dizzy, but I've caught myself, but I haven't landed on the floor.
Right. Okay, and that's it, just the one?
Yeah,
So what happened, can you remember what happened that time? When was it, for starters?
it was was on the Sunday.
Sunday just gone?
Yeah,
And what time of day was it?
first thing.
First, what, straight out of bed, or?
Yeah, but maybe it was slightly quick because I have been sort of sitting on the bed for about 5 minutes before I get up.
Right.
Because of coming over dizzy, sort
Right.
of taking things much more slowly.
Okay. And when you say dizzy, what's happening?
The room's just going round.
The room's spinning around?
Yeah.
Okay, and how long does that last for?
It can last anything up to a quarter of an hour, and then it'll sort
Settle
of
down.
settle down.
Right. Okay. And on that occasion, but on Sunday, you think you got out of bed too quickly?
Well, I did sit there for a couple of minutes, but maybe it just wasn't long enough.
Okay. And then you stood up and you just wobbled and you caught yourself?
Yeah.
Is that right? Does the room spin every morning when you get up out of bed?
No,
That was an unusual.
it's intermittent.
Intermittent. Okay. Is that the last time you can remember it happening?
Yeah.
Is that the only time it's happened since I last saw you?
But yeah, because as I said, I've been really sitting down for a long time before I get up.
Right. Okay. And how do you feel in yourself?
A little bit better.
Okay. What do you think's been causing this?
I'm not sure.
Right. Okay. It's interesting. It's only happened once in the last 2 weeks.
Yeah.
But it happened 3 times, hadn't it, the week before?
Yeah.
Yeah. Have you had the recording of the heart?
Yeah, I had an ECG.
Right. Okay.
And the blood test.
Okay. Blood tests are all fine.
Yeah.
I can't see the recording of the heart, so I need to check that out. So I'm a bit concerned about it, really. So what should be happening? It sounds like quite a severe symptom.
Yeah.
And I think that we should actually get you checked out and see what's going on.
So is he smiling?
He is.
Yes, not at the moment, of course.
And, but yeah, he is.
He does smile. How are you?
Yes, you're a very friendly chap. Yes, you are.
She's tiny, isn't she? Little dot. That's a good girl. Oh, she's taking it well.
Hi, young man. Tummy feels lovely, soft.
Enjoying that little massage there?
You don't normally get this on the NHS.
No.
That's a lovely smile there, young man.
What does that mean?
How can I help?
One concern is he's getting pale
Okay.
and he's eating a lot of paper. Paper, tissue paper, books, newspaper.
As in he's putting it in his mouth?
No, eating and swallowing. Like he just chew and take inside.
Right, okay.
And he's getting pale and his eyes are getting like puffy from last 2 weeks. Before that, it was not like that.
Okay. And the swelling is just in the face?
Face, yes,
Okay.
puffy eyes.
Okay. And so what sort of things were you hoping for? What sort of things do you think we could do?
Like my sister is doctor as well. She's in Germany. So she said you better consult with a doctor for the thyroid and the kidney tests.
Okay. So what I'll do today is just give him a general check over.
Yes.
All right.
I just want
and then
to
we can
just suggest him a blood test.
Yeah, and then we can do that.
I like that. Look, his whole body is very.
And that's
like-
not his normal colour.
Look.
Yeah.
You can see his feet's a bit yellow. Yes. Okay.
Oh, it's all right. I think one thing we can do is do a blood test to check if he's anemic, to check like the kidneys, as you mentioned. We can also include the thyroid blood test in that, and also the vitamin D. All right. I mean, the issue with the paper, I think it's likely that it's probably a phase that he's young and that kids put stuff in their mouth. Let's do the blood test. They normally take about a week to come back.
If there is something fishy, so they will call you.
Yes,
right,
so
same day.
I will keep an eye out for the results anyway myself, and we'll let you know and bring you in for the
I'll
appointment.
keep in mind. So
All right.
definitely in the morning I will
Yeah.
go there. Thank you,
All right.
Dr. Taylor. Thank you.
No problem. Take care.
Bye.
And I think it should be the heart specialist, because it sounds like it's like a heart thing.
Yeah.
Although the women's been around because you're feeling faint and falling, than it being a balance thing in the ears.
Yeah.
Is that okay?
Yeah.
Can we weigh you?
Yeah.
Sharon came to see me because she has the symptom that she described as dizziness. Her background problem that she has diabetes, but Sharon has a particularly severe form of type 1 diabetes. She also has quite an unusual condition in that she has too many platelets, which are the little bits of the blood that help you to clot if you have a cut. And she's on treatment for that. And in the past, she has had a very severe form of depression that required her to be hospitalised for a short period of time. That was called psychotic depression. That was 9 years ago now, and she's completely recovered from that and had no further symptoms. When you have this dizziness, are you aware of your heart beating quickly or missing a beat, or...?
Haven't. I do get sweaty. I don't know if that might be a sign that it is.
Right, OK. Let me have a quick listen to your heart and your lungs today, can I? Listen down here. Yeah, someone's the heart murmur. I'm not saying it is, but we need to get that checked out as being part of this. So, I'll write the heart doctor and see you again, see if we can find out what's happening with this.
Okay.
Okay. In the meantime, I don't know what else you can do really, other than exactly as you are doing. When you get out of bed, sit down and don't rush out of bed. When you stand up, it's quite a complex thing for your heart and your cardiovascular system to maintain the blood flow to your head. It's gone from lying down to standing up. It's still got to get the blood to your head.
Yeah.
So it has to take some adjustments. And I think for you, it might be taking a bit longer because of all your other medical conditions.
Yeah.
And therefore, if you stand up too quickly, the blood doesn't get to your head and you fall down. Okay. Thanks for coming in.
Okay, just bear with me one moment. Let's find you. Friday the 15th. Oh, that's my writing.
Lovely to see you.
Thank you. I'll come and see you in a bit.
Yeah.
Fill you in.
Logan Reed. Are you Logan? This is Hussein, who's sitting in with me today. He's a student. So Logan tells me that he's just had ulcers on his side of his tongue since yesterday.
Yes.
Okay.
And he's recently just moved up to the 8 mils of Tiflotol.
Yeah.
So we were told to look out for things like that.
Yeah, absolutely, yeah. Good, we'll have a look. When did he move up the dose?
He's been on 8 milligrams since Tuesday.
Okay, right, okay. How's he doing in himself on the Tegretol?
Yeah, not bad.
Not bad, yeah. So Logan is a delightful chap. He has a form of epilepsy called temporal lobe epilepsy. Tegretol is a very useful medication for epilepsy, but can cause mouth ulcers.
Have you got your big R voice on?
Is big what? Oh, very good. Excellent. You certainly have. You're ready. Is that where you're
Well, you only sort of feel it here.
but do you feel it out in your skin, or do you feel it in the inside of your mouth?
Only in the inside
On
of
the
my
inside.
mouth.
Oh, okay, so open your mouth wide. That's right. Really good. Stick your tongue out. That's right. Yeah. Is it that side that's sore? Yeah, very good. And say "oh" again. Fantastic. The number of children who they'll open their mouths, etc., but they won't say that "ah" nice and loud. You know, you could hear that down Slough High Street.
No, you couldn't hear that.
No, that was just a joke. That's good. Just want to look at the inside of your mouth. Well done. Bring your tongue back in, Logan. Yeah, that's good. So just point to me where it's sore with your finger.
What, the jaw?
Yeah, just
The
yeah.
jaw, where'd you-
Oh, it's the jaw there, right? Okay, yeah. Good. Well done. So I think that, and this is just a viral ulcer.
Yeah.
And I think that it will go after a few days. It's
Okay.
not connected with his treatment. It's not that
Right.
kind. The
Okay.
kind of mouth and we call stomatitis, inflammation of the mouth, with this medication is very clear, is very distinct, causing mouth ulcers.
Yeah.
And sometimes it can be really severe, blisters around your lips and so on. And that's not what he has, but it's the right thing to do to come in. So this is just a virus in his mouth. I'm going to give him something as a mouthwash to
Right.
use and just swill it around, spit it out. Don't swallow it.
You know how to use a mouthwash, don't you?
Oh, yeah. Put it in mouth.
Swish it round. You don't
Yeah.
swallow it.
Mm-hmm.
That's it. Well done.
That's it.
It's just like bubble gum. You never ever swallow bubble gum.
That's right. Do you know what part of the body that is, Logan?
The spine.
Good. Well done.
I can tell by these bits here.
Yeah, that's right. They are, absolutely.
Those bumpy bits that you can
Those-
feel in your back are exactly these.
They are exactly those. That's really good. You know, there's an awful lot of grown-ups who don't know that.
Ah, I see.
So you're doing really well. Logan, nice to see you. Well done. And hopefully these ulcers will clear up. I'm sure they will with this mouthwash. All the best. Bye. Bye now.
See ya.
Mm-hmm.
I really need.
Alan Brown. Come on in. Have a seat down there.
All right, you're all right.
How are you? I don't often see you in this capacity. I usually see you in the corridor, don't I?
Well, I'm not a doctor person, really.
Yeah.
I like going to doctors. I think, was it you saw me before about my hernia?
A long while back, because I was looking through the notes, and it was back in...
Well, because I'm such a coward, I didn't do anything about it.
So that's 2011. So when I did the referral, you didn't go, basically? Okay, right.
But a friend of mine died from MRSA,
Yeah.
and although things have changed, I know they've changed, but...
It sticks in the mind. Okay. So what's changed?
It has got much bigger, but what's prompted me, I went to a funeral the other week, and a friend of mine has just had both sides done.
Okay. Can I have a look at it again?
Of course, yeah.
A hernia is a protrusion of an organ through its containing cavity. The type of hernia that Alan had is an inguinal hernia, which is where you get bowel contents protruding through a muscle defect in the lower part of the abdominal wall. Was it extending down that far last time I saw you?
It was going that way, but it wasn't. I don't think it was as low. But it's got quite big. And I'll be honest with you. What's quite embarrassing is that in the trousers and shorts, other people are noticing it. And see, laying down, it's not as big.
Can I get you to stand up as well, if that's
Of
all right?
course.
Yeah, it's more obvious up here then, isn't it?
Yeah, and it's noticeable when I'm dressed. You know.
No, you get changed. The pros of treating a hernia is that you can avoid the complications that can happen in the future. So in other words, strangulation being the one we worry about the most. The cons of treating a hernia include any of the risks of having surgery, so for example, infection or bleeding or anaesthetic risks. Specifically for hernias, you have something called a mesh repair, and sometimes that can fail, and then you can end up needing repeated episodes of surgery. I think you need to have it done, to be honest. So I'm going to do that referral.
The good thing is I don't get any pain.
Yes.
I've never had any pain or anything like that.
Yeah.
It's just there, and it's just not nice.
Yeah, it's getting bigger, isn't it? And
Yeah, it's, you know, when you're on holiday and things and shorts and...
Yeah.
It's just not, you know, it's a bit embarrassing, really.
But can you get it back in all the way? Because I could partially reduce it.
I can get it all back.
Yeah.
But the moment that you let go of it...
It comes back out.
It comes back.
The good thing is that you can put it back in. That reduces the risk of it becoming an urgent problem. But, yeah, if it starts getting stuck or it starts turning purple or the pain starts getting really bad, then you need to come and let us know, like, as an urgent issue.
Excellent.
Good. Nice to see you.
Thank you.
Take care. See you. Bye.
Come through. Okay. Have a seat. Okay, so we met before a month ago.
Yeah.
How have you been since I saw you?
Oh, I've still got this thing. It don't look like it's getting any better at all.
No. I remember you showed me last time this darker area of skin. I gave you something called dermal cream. It works for certain patients, and it's very hard to predict with some of the moisturisers, but I think with this condition you've got, at the same time, some other things came up. We were talking about your blood test previously, about your liver, and I noticed you then came and saw another colleague of mine who talked to you about some of the results that you had. So,
last week, wasn't it?
Yeah.
It's pretty scary.
Yeah, the liver has to be checked.
Well, we've got
we had
21st, we're going for a scan.
Okay.
I'm not too sure what it's being scanned for. It's still, I mean, there's lots of words being thrown around, but no one's saying anything that really is definitive about anything. And with Stephen's other issues, I need to be a bit more definitive about what we're actually looking for and looking at, because it is causing problems in other areas of the worry of this, that, or lots of words being bandied about.
Mr. McDonald, one of his main diagnoses is related to type 2 diabetes. He has had some suspicion of rheumatological problems. In addition to that, the reason I saw him was because of a skin rash that he had developed on his leg, which hadn't been clearing away with conventional treatments that my colleagues had tried. What do you understand so far?
All we've heard is autoimmune, we've heard possible, maybe some form of cancer, we've heard all kinds of crazy stuff going on, and it's just not, you know, I'd rather they say nothing and just let us go do what we have to do. But if there is something that's leaning in one way or the other, I'd rather he know about it now, because it is causing problems in other areas.
Hello.
Me again. I wonder if I can make an appointment for somebody to have a look at my finger.
Oh, what did you scratch it on?
Well, it's just that little scratch there.
Does it hurt?
It's hot and itchy.
All right.
And does any pus or anything come out?
It just feels like a big pea.
Yeah.
It's too tender to sort of...
Yeah, to squeeze anything out.
I do suffer from leg ulcers and...
Your legs are a bit swollen, aren't they?
Yeah, well, I've been at work since 6 o'clock, so...
Have you? For you.
It doesn't look very typical of eczema, and it doesn't look like a fungal infection at the moment. I think it'd be worth taking a skin swab and sending it off to the lab.
The backs of the thighs were weeping. Driving to work, by the time I got there, my seat was soaking.
There's a bit of a jigsaw puzzle here, and we're trying to piece things together. At this stage, we have an idea that your liver enzymes aren't entirely normal, but that's been the case for some time. It might be that in the past it was thought to be due to your medications that were given. You are on quite a few that do involve the liver to help process the medications, so that could be a reason on its own. But until we exclude the other things, we can't just jump to that conclusion.
Right.
Now, what's also complicating this is this thing you've shown me on your leg. When you have bloods like that, we need to make sure you don't have like a rheumatological condition, which can lead to these sort of things where you get skin changes, Sometimes you get liver changes. Do you get joint aches?
He has arthritis.
Yeah.
I suffer from
Rheumatoid arthritis. Given that it's not open now, so if I just have a look one more time, and it's relatively dry, I think last time I saw it, it was a little bit more wet feeling. I think it would be reasonable. We could give you a stronger, a sort of steroid cream stronger than what you have with the Lotriderm, but it's just purely a steroid cream. What I would suggest is you can continue using that for the next four weeks. But if it starts to become very weeping and hot and red in that area, then you would discontinue it, and you might need to see a doctor sooner in case there's a risk of infection, cellulitis. But otherwise, you can continue.
All right.
And in the meantime, the liver test should come back, and then we can touch base if you feel you're not sure where things are going. But I am going to refer you to rheumatology today.
Okay.
All right?
All right, then. Thanks, doctor.
Okay. Take care.
All right, you take care. Thank you.
I love you.
Love you too. Michael Murphy, please.
That's us. Thank you. Come on, Murphy.
Hi, come on in. Hi, you're right.
I think we've seen you before.
Yeah?
Yes, we have.
Okay. I've definitely seen you before. Yeah. 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 How are things?
Not all too great.
He's getting there. He is getting there.
Yeah, I am getting there, but still, it's kind of hard to.
Still needs his pills.
And how are things otherwise with your mood, with your general mental health? How are things otherwise?
Yeah, things good. I mean, I've had a few little hiccups, haven't I?
Yeah, but it's nothing major. Nothing that you'd be worried that he's deteriorating.
Yeah. So Michael had seen me in the past for problems regarding his mental health, mainly regarding his difficulties with his anger management.
His mental health, since coming out of hospital, has hit a major high for him. It's his attitude towards people.
Yeah.
I've tested him a few times. I've
Yeah.
rung him up, pretending to be someone else,
Okay.
saying that he's going to get in trouble
Yeah.
at work, and
Yeah.
he's like taking it on the shoulder, and he's like, "Okay, that's fine." He goes out. I'll come
Whereas
to the
something
office.
that would normally have got you quite
That would've-
agitated. Yeah.
He would have been rah, down the
Yeah.
phone, and he's not. So I'm really
Okay.
proud of him for that.
Good. So those things are improving.
Yeah, altogether, I haven't felt like the urges of punching and all that kind of like stopped and stuff like that, you know.
Yeah.
Like, so I've kind of stopped all that kind of thing.
Okay. It's a bit more chilled out.
Yeah, a lot more chilled out.
Yeah.
So I haven't got so much incredible
Sort of anger.
mini Hulk going on inside
Yeah.
me, you know.
Yeah.
So
Yeah.
it's all cool.
Okay, good.
So on this occasion, he'd come to see me because there were ongoing difficulties with gaining and maintaining erections, otherwise known as erectile dysfunction. And we'd agreed to trial some medications to help him with this problem.
You can see you've been having the pills for a while, haven't you now? How long? have you been taking them for?
2 months. Yeah.
About 2 months. Okay. What do you think? I mean, and welcome to chip in as well. I mean, what do you think kind of was the main thing contributing to it?
His exercise, lack of exercise. That's what I think, because since you've been running, he's... I see an improvement. I see a massive improvement.
Okay.
I don't think he does.
No, I still don't feel as confident in certain things, you know.
Erectile dysfunction is very commonly associated with mental health conditions and can sometimes also be made worse by certain medications as well. In Michael's case, given that he had quite a significant background of mental health problems, particularly with regards to his mood, it was quite clear that this was probably the causative factor for his symptoms.
But listen, there's a lot of positive things that your partner's saying here.
Yeah, I know.
Yeah.
Definitely know. It's just
There's a lot of good things that she's mentioned today that you should be proud of, from what it sounds like.
I should. But
Yeah. Maybe it's about getting that self-confidence back, actually.
That's probably.
Because what I'm hearing is actually that maybe a year ago you were someone who may have flown off the handle quite easily and you had a lot going on.
Yeah.
And you seem to have turned the corner a bit.
The thing is, we've just got engaged, so it's like...
Oh, fantastic. Congratulations.
Thank you.
Thank you. High five.
He always wants to high-five someone. I see loads of improvement with him. So it's like, if you can see that from a year ago you've come this far...
Yeah.
Yeah, that's true.
I think you've done amazing.
Sorry, I
don't think you need
That's a lesson you have to learn. Always listen to the lady.
Yeah.
She's always right. Yeah.
I don't think you need...
I think as far as that's concerned, I think you need to maybe just look at what's going right. Okay, look at the things that are positive, and focus on those things, and you'll find actually that the other things might follow, and that you eventually might be able to get the confidence and maybe come off these pills. You know, because I think like I said at the beginning that this is probably psychological. Almost 99% this is psychological. That it's your brain that's stopping the lower half from working as it used to.
Yeah.
Yeah. All right.
Okay, that's brilliant.
Brilliant.
Thank you very much.
Oh,
Remember, golden rule: always listen to the other half.
Good man. Have a nice day.
All right. Take care. All right. See you later.
Oh, sorry.